everyone, my name is Alabi Abisala Moreni Keji, and I'll be your personal civic education teacher on the topic preventive measures of HIV or AIDS. Firstly, let us define HIV. HIV, also known as human immunodeficiency virus, is a virus that attacks the body's immune system, specifically the CD4 cells, which is also known as the T cells, which helps fight off infections, and if left untreated can result to AIDS. Now, the preventive measures of HIV or AIDS. Number 1, abstinence. Avoiding sexual activity is the most effective way to prevent HIV transmission. Number 2, faithfulness. Being in a mutually monogamous relationship with an HIV-negative partner reduces the risk of transmission. Number 3, needle exchange programs. Using sterile needles and syringes for injecting drugs reduces the risk of the transmission of HIV or AIDS. Then number 4, condom distribution. Making condoms widely available and accessible, especially in high-risk areas, also reduces the spread of HIV or AIDS. And I'll be handing over the phone to my colleague Ali Owezina. Thank you.
Good day, everyone. My name is Ali Owezina Badebisi. I'm a personal teacher on civic education, and I'll be talking on the topic preventive measures of HIV and AIDS. What are the things to prevent HIV and AIDS? Number 1, using condom. Constantly encourage use of condom during sexual activity. Reduce the risk of HIV transmission. Number 2, regular testing. Getting tested regularly for HIV and encouraging our partners to do so help in early detection and treatment. Number 3, avoiding sharing needles. Using clean needles and syringe, and do not share them with others. Number 4, reducing number of sexual partners. Limiting the number of sexual partners can decrease the likelihood of exposure in HIV. Number 5, ensuring safe blood transmission. Ensuring that the blood products are tested for HIV, especially in the medical settings. Number 6, education and awareness. Understanding how HIV is transmitted and practicing safer behavior are critical in preventing HIV and AIDS infection. Thank you. I'll be introducing my colleague, Johnson Adiola Francisca.
Good day, everyone. My name is Johnson Adiola Francisca. I'm your personal teacher on the subject civic education, and I'm going to be talking about how to care for people with HIV and AIDS. Caring for people with HIV and AIDS requires a comprehensive approach that addresses their physical, emotional, and social needs. Here are some ways to care for them. Number 1, educate yourself. Learn about HIV/AIDS, its symptoms, treatment options, and prevention measures. Number 2, provide emotional support. Listen to their concerns, offer encouragement, and help them cope with stigma and discrimination. The third one is encourage adherence to treatment. Support them in taking their medications as prescribed and attending medical appointments. And the last one is foster a healthy lifestyle. Encourage balanced nutrition, regular exercise, and sufficient sleep. I'll be introducing my colleague, Arejemiolu Adebora. Thank you.
Hello everyone, my name is Arejemiolu Adebora, and I'm going to be your personal civic teacher. And I'm going to be talking about the ways to prevent HIV/AIDS. 1, show empathy. Understand the people's feelings and challenges without judgmenting them. 2, encourage treatment. Support them in following the prescribed treatment plan, including medication and medical checkup. 3, promote wealthy lifestyle, which include encouraging a balanced diet, regular exercise, and adequate rest to boost their immune system. 4, ensure medical care. Help them access health care services and accompany them to medical appointments if needed. Thank you.
My name is Ali Azizat Oluwadamilola. I am your personal teacher on civic education. The topic for today is HIV and AIDS stigmatization. What do we mean by HIV and AIDS stigmatization? It refers to the negative attitude, belief, and behavior that people living with HIV and AIDS face from others, leading to their social exclusion, discrimination, and marginalization. This can result in 1, social isolation. That is, people living with HIV and AIDS can be shunned by family, friends, and community. 2, discrimination. HIV and AIDS people may face unfair treatment in healthcare, education, employment, and even their houses. 3, we have fear and mistrust. People may fear HIV transmission or associating with people with HIV and AIDS. 4. Loss of identity. People living with HIV and AIDS may feel defined solely by their condition, losing their sense of self. I'll be handing over to my colleague Aremu Abdulkoyum on the topic how to perpetrate and reduce the HIV stigma.
Hey everyone, my name is Aremu Abdulkoyum and I'm your personal teacher of civic education, and today I'll be talking about how HIV and AIDS stigmatization can be perpetrated. HIV and AIDS stigma can be perpetrated through lack of knowledge, because when people are unaware of how HIV is transmitted and realities of living with the virus, they may stigmatize those affected by it. So we have cultural and religious belief. Some cultural or religious belief may contribute to the stigmatization because their misconception about HIV and AIDS is being a punishment for immoral behavior or result of divine punishment that can lead to exclusion of those living with the virus. 3, we have media representation. Negative portrayal in the media can reinforce stereotypes and misconceptions about the virus. 4, we have lack of empathy and compassion. Lack of empathy and compassion towards the individual with HIV can result in stigmatizing behavior, negative attitude, stereotypes, and judgmental views about the virus. And here are some efforts to reduce the stigma. 1, we have education and awareness campaign. Conducting education programs and awareness campaigns to disseminate accurate information about HIV transmission, prevention, and treatment can help dispel the myths and conception about contributing to the stigma. Then 2, we have healthcare provider training. Providing training for healthcare providers on stigma-free care. Then 3, we have community engagement. Engaging in communities in open discussion about HIV and AIDS, providing support services and creating a safe space for a dialogue and foster acceptance and reduce stigma and grassroots level. Thank you.